Well, hello everybody. Welcome again to another one of our In Conversation series, and I'm delighted to be joined today by the wonderful Rachel Power, Chief Executive of the Patients Association. Rachel, thanks so much for finding the time to be with us today. It's great to see you as always. I was just thinking about this. We first met each other in a pub, actually. It wasn't that sort of meeting, for people wondering. It was a planned meeting, but I'm looking forward to being able to do that with you again shortly. But we do appreciate your time. Again, we've done a few of these. We've had the Royal Colleges on recently, so I'll start with a question I've always asked them. Everyone will have heard of the Patients Association, but they probably wouldn't be able to explain it to their mates in any detail. So tell us a little bit about the association, your work, your heritage, and maybe your vision for how it might develop in the months and years ahead.
Yeah, thanks, Richard. It's lovely to see you too, and hopefully we can meet each other in public very, very soon. So the Patient Association has been around for over 60 years. Its origins was a part-time teacher called Helen who felt that parents weren't getting enough information around thalidomide. And so our journey has grown from there, and I see us as an independent patient charity that campaigning for improvements for patients. I think uniquely we are non-disease, non-condition specific, and we work with patients directly, and they are our members and supporters. But we also work with hundreds, thousands of other people who benefit from the support of our helpline and advice services. So I think we take what we hear and we speak to government, we speak to NHS about patient priorities and concerns, and our whole thing is around the patient voice being heard and listened to. So not just heard, but listened to. So I've been there coming up to 4 years, which has gone really, really fast. And we just developed a new strategy this year. And our new strategy, I think, whilst it was developed during a year of COVID, it isn't a response to COVID, but I think it's a really important time that we start to talk about true patient partnership. So where do I see us in 5 years' time? I want to see the Patient Association as the go-to organisation to help institutions, the NHS, everyone to practice true patient partnership, so that patients are involved in the design and delivery at the earliest possible moment of any healthcare service.
Great. Well, that's brilliant. Yeah, noble ambitions, Rachel. So what are your other reports that's just come out recently? So we're recording this at the back end of May 21. Last month, I think your report, the Pandemic Patient Experience 2 came out. So actually I've been kind of guilty of this probably. We've done a series of these with senior health system leaders, and we've taken very much a medical view of this and how the medical staff done, how has the healthcare system cope with it. But lest we forget, obviously the people this has impacted most have been the patients that have needed to use those services. Tell us a little bit about the report and some of the headline findings.
So I think to start with, frontline staff have had a really tough time. There's no doubt about that. They have worked extremely hard to do what they can to do their best for patients. But what's happened, this was our second report. We did the first one at the beginning of lockdown to see how patients were feeling about what was happening to them. And we decided at the beginning of this year to just go back and check in from what we were hearing on the helpline as well, and what we were reading, actually what was happening to patients out there. So we went back and we checked in, and we found that actually the struggle to access services the patients had found at the beginning of the pandemic was continuing. And whilst it was less severe, it was still happening. And access to primary care was what patients were finding particularly difficult. The issue around digital and the future of digital, well, digital is hugely important for the future of the NHS. Digital appointments and forms of care hadn't become mainstream for the patients that we spoke to. And instead, they were finding that remote consultations were mainly by phone, and patients were finding them as a poor substitute. They didn't feel that their care was as good through those methods. So one of the things that we called for was the return to face-to-face appointments. And we were delighted last week when NHS England wrote to GPs to say, and a lot of GPs were doing face-to-face, but it needed to be more mainstream. And I think if you think of our patient partnership, this is about digital will work for some and it won't work for others. And we need to understand what works for the patient and work with the patient about what matters to them to ensure that they got better. So the report also showed quite a lot about the disruption to patients. So 1 in 4 patients who had appointments arranged in the last year saw them going ahead without being postponed or cancelled at least once. What we found, so there's a rhetoric where patients are staying away from the system because they're worried about going in either because of COVID or because of overloading the system. But actually, we saw that 63% of our respondents had their treatment cancelled. So rather than them staying away, it was actually cancelled. And over 55% of them were worried about, what's happening to their conditions because they're not getting on. And as we speak this morning, it's 28th of May, we've heard this morning quite a lot about GPs and saying that, primary care looking for more money. So I think there needs to be a new conversation, and we can talk about that in a second. So 70% of our patients patients that responded were also talking about that they were very worried about being able to access the treatment that they needed in the future. And again, that's playing out at the moment in the media with the NHS asking for more money. So I do think there needs to be another conversation here, because actually both the system and patients have been affected, and the relationship is damaged because people aren't able to get the care that they need. So, but actually prior to the pandemic, we knew there was a funding issue, and the NHS is not funded. It does not get enough money to run the services. So I think, and that has had a huge impact on patients, but also had a huge impact on staff. Shielding was interesting in our report, because one of the things that through the last year we were hearing from patients is that they did not like the term clinically vulnerable. And what actually we found was that a lot of people who were shielding on the knowledge of what they knew about their condition rather than being actually officially told to shield. So that was quite interesting, and that again goes back to our patient partnership, because actually if you work with a patient, they will make a decision about whether actually we need to shield now. And in our first report, a lot of patients who really relied on services such as, your shopping turning up, they felt abandoned by the whole system, because if they weren't on the clinically vulnerable list, they weren't getting priority slots for supermarkets and work like that. So the real positive, though, in the report was the vaccination programme. And people were just hugely positive about how it had worked for them. They thought the appointments, how the system worked, how they got the text, it was all very well organised, quick appointments, and felt confident on how they were being dealt with when they turned up. So that was a real win-win, and it's a great thing to see the NHS having done such a fantastic job on that. The other bit that came out, the overall handling of the pandemic. So we asked that question this time because we'd been a year in there, but that was very mixed. And the trend overall was to the negative. But it was interesting because the cohort of patients who actually completed the survey this time, they were ones who had been in the first few cohorts of vaccination. And the ones who were vaccinated were actually much more positive about what had happened during the pandemic. So I think that's kind of the key piece of information coming out of the pandemic report. But I think that leads into our patient partnership, because one of the things that we've been speaking a lot about over the last year was that, patient involvement pre the pandemic wasn't at where it should be. And if you look at the ladder of engagement, we're halfway up that ladder, and we need to get up further. And at the beginning of the pandemic, absolutely correctly, probably because of where we were and where we prepared, and there are questions that public inquiries will need to answer in the future, patient involvement was wiped aside, and things were just moving on, this transformation, and it showed the NHS could do such amazing transformation. But we're at a really crucial point now, because as we rebuild or transform or reset or all those different languages that's out there about what's happening, we really need to talk and push that if you want to do a service, if you involve patients at the very beginning, then it's probably going to be more effective and it's going to meet the needs of patients.
Actually, I was going to ask you about that, actually. patient involvement, as you say, it's perhaps historically been a sense of it's slightly lip service. I was reflecting before I was speaking to you today. I served on the appraisal committee at NICE for quite some time, and we had we always had patient experts, they were called, coming and talking about technologies, and kind of very often they would complain that they were presented with a lot of very technical papers, and we'd say, well, you know, this is a kind of technical business. But there was an element, and the one time I can remember it making a real difference was we were looking at CPAP, this mask you put on, and the committee, I tell you, were very hostile to the technology. They thought it was for blokes who are overweight and ate too many chips or whatever, and were snoring a lot. And we had the patient expert came in, and he was a hefty chap, I have to say. And I think, to be polite, the chairman said to him, "Oh, well, okay, well, just have you got one of these things with you? Shows the technology." And they handed him this thing, which looked like, I don't know, reminded me of a John Wayne film when I was a kid. He was a deep sea diver, and he put this thing on, and the room went quiet, and the only sound was 30 pennies dropping from the committee members. And someone said, do you actually wear this when you go to bed? And he went, yeah, I have to. And it turned the committee over and said, well, actually, this is a serious condition if someone is prepared to put that on when they're supposed to be going to snug up. So I just wonder to what extent you think the recognition of that type of experience, not forgetting all the technical bits of it, was incremental cost effective ratios for NICE, or how you organize services and you fund them. That's maybe one thing, but do you think the experience of the pandemic will have policymakers and people who run health services thinking a bit more about the actual experience, given what everyone's been through, and people have not been able to see loved ones, and people have died in awful circumstances? Are you kind of optimistic about a sort of re-energized or refocused patient involvement?
No. But that comes with a large proviso, because I speak with so many people within the NHS who are really passionate about getting patient involvement and engagement right. And we just did a huge piece of work with the elective task force around good communication principles, and everyone in there wants to get it right for patients. But how the system and there are some amazing examples of patient engagement out there. But how to get the whole system to get it right, I just don't know. And I don't know why it doesn't happen, when I can talk to such passionate people about why they want it to happen and why they really see the role of patients. But I think it's that thing about looking holistically at an individual and saying, actually, you know, what matters to you and what's important to you. So if we go back to your gentleman who has to wear the CPAP machine every night, you know, that's about him living his life to the full with whatever condition he has. And so when we started it, we did a small scale consultation on our strategy, mainly because we were in the middle of a pandemic. But we spoke to members of the Patient Association and said, okay, so, you know, patient partnership, how do we do it? And they all came back and said, yeah, we really like the concept. We think what you're trying to do is really, really good. But actually, we need to be enabled, and we need to be informed on how to do that. So we've just appointed to a head of patient partnership, and one of the first areas that Sarah will be looking at will be around, actually, how do we empower, how do we do that power and give it to the patient? So we talk about co-production, we talk about shared decision making, you know, all of these language. Actually, what does that mean to me as an individual? And we have a lot of patients who are very expert in what they're doing and what they're talking about. But we need to get to those inactive patients as well if we're going to have true partnership and true engagement. And what we have to be really careful of is, you know, the pandemic highlighted health inequalities, but, you know, they were around for years and years and years. And actually, I think that if we can do partnership properly and understand what matters, then I think we can actually reduce the health inequalities. And one of the things in this transformation that we keep batting back, even though, you know, I'm really pro digital is a great way forward for healthcare, but actually there's a risk that digital can actually widen that gap rather than, and, you know, we've seen it through the pandemic in terms of education and kids working, having to be at home when schools were closed. So, take that on a few years when they're accessing healthcare services. So I think we will do a huge piece of work this year, in the next year, on how do we empower patients, what's out there. And we're doing a big piece of work actually on some of the tools that are out there about shared decision making, and NICE are coming out with their guidance on shared decision making in June, and we're hoping to issue a report around the same time, because there's so many tools developed around kind of partnership, and actually how are they used and how are we engaging patients. And I think that's what we have to get to.
That's really interesting, Rachel. I was wearing my NHS hat. I was at a conference yesterday, virtually on race and inclusion and equality there, and we talk a lot about inequalities, don't we? And what the pandemic is really, as the point you made really, really well, what the pandemic has really done is highlight yet again where those inequalities have always existed. So on that sort of, let's think a little bit about the digital thing, and back to what your opening comments from the survey, the report. This sector is really excited about what we can do digitally, what we can do remotely, all this fancy tech we're using now to do this. The NHS long-term plan was all about delivering care in non-traditional settings. And it kind of made me stop a little bit when I read the bits of the report saying, well, people we missed something. The telephone is one thing, but the fact is there is likely to be more of this, using this sort of technologies to interact. And the long-term plan is really trying to basically keep people off of NHS estate. They don't need to be there. Be interested in your thoughts on that, and how maybe what some of the people listening should think about as we think about being clever about how we can do things more and more remotely, but how that might actually impact on the patient experience.
So I also chair a coalition whose name I am not going to remember right now, but it's Digital AI, and it's about putting patients at the center of digital transformation. And actually, if you want to send out a copy of this to your members, I can let you see it. But in there, and in that report, there are some excellent examples of where digital's worked really, really well. And digital does work for an awful lot of people really, really well. But we've made recommendations in there for NHS and for the government. And really, the balance of those recommendations are, bring people with you. Always maintain a choice. And, we are in a transformation. Have conversations, work out what works for people, and then involve them at the earliest possible stage. There's still a concern around data and how their data is stored. But what, we need to go on this journey. We can't get to a point where we shouldn't be at a point where we say, this digital thing is great right now. Actually work with patients, find out that it works for them, bring people on that journey with you. And in the same handwriting, there was a lot of people in the surveys over the last year who love digital. But it's just one size doesn't fit all. But digital is, has to be part of the health service.
That's great. That's fascinating. Fascinating, Rachel.
And I think the patient partnership piece as well. It is about building assurance. It is about going on that journey with people. It is about, so I was on a call a few weeks ago, and it was about a digital way of working in the NHS. And what I saw was really positive feedback about how it was working for patients. But my challenge to them back was, actually, it can't have worked for everybody. So who didn't it work for, and why didn't it work for them? And let's start from that point, because if we can start understanding why it's not working for people, then we can help make it work for people with them in partnership. And I think that's the problem. Sometimes you just get too many of, this is such a fantastic, thing, and like this digital innovation is fantastic. And it probably is, but it's not going to work for, you talked about race and inclusion. When I talk about health inequalities, I think about geography. do you have Wi-Fi? I think about poverty. I think about your housing, where you live. Can you afford to have Wi-Fi? Do you have a iPhone that connects and you can do video with? Do you have a safe space to talk? And in our women's health strategy yesterday, that in the draft of our response to the government strategy consultation, a few women talked about, actually, this is great, it works, but actually I have nowhere safe to talk, and I don't want to talk about my medical needs in front of my children.
Yeah, they're all really good points, Rachel. Easy to forget, aren't they? And particularly from someone like me who gets kind of very gung-ho about what we can deliver remotely and avoid the need for people to actually come into hospital. And actually, that may be very necessary for a lot of the points, not just because of what needs to happen to them during that consultation, but actually to.
But also sometimes that's where, you know, and it is about becoming more comfortable with things. But it's like working from home, like we've all been doing for the last year. 15 months now. I regularly am so grateful that I have a spare room that I've been able to use as my office. I'm not in a shared house. I'm not, you know, having to work in my bedroom on my ironing board. All of these stories that we've heard. So we just need to have that larger conversation.
Yeah, absolutely. Yeah, and it resonates as well. I know we've got some young people who work for us living in London doing their best. They haven't got outside space, and it's the aligning board thing is very real. I think
absolutely. And in the same handwriting, you know, a lot of my colleagues say to me, you know, this isn't what I signed up. I didn't sign up for my house to become my workspace. And so the minute they let me back into my workspace, I'm going back in. So, and you know, so it's like anything, it's going to work for some people, and it's not going to work for all. And we've got to maintain that choice and work with people to understand why it might be more beneficial for them to access treatment in a different way.
Great, Rachel, let's just to finish up then, I mean, a little bit more about the Patients Association. People have always felt you're this huge gargantuan organisation as well. But I know you're an organisation that has punched massively above its weight for a lot of years now. But you do need support, and there are opportunities, I think, for people listening to engage with you and offer some support. But also in terms of some of the work, I think you've given a superbly lucid description of why anyone developing remote technologies probably ought to come and speak to you. But just talk to us about some of those opportunities and ways you think you may be able to help some of particularly the more entrepreneurial companies listening who've got new kit they want to develop and have maybe not kind of joined up the fact that there's an individual got to be on the receiving end of this at the end of the day.
Yeah, no, absolutely. So we aren't huge, like you say, Richard. I'm absolutely excited to be appointing to one new staff member in my head of patient partnership. And I think that brings us to the grand total of 10 employees. That includes some part-time working. And we are based in the beautiful Portakabin on the grounds of Northwood Park. So no, there's a lot of way people get involved, and some of your members are, you know, corporate partners and make, you know, very generous donations to us every year to allow us to continue the core work that we do about speaking up for patients and achieving change. But there's a lot of other ways that we can help as well. So we do a lot of project work for different organisations and companies, and that can be just getting together focus groups of patients so they can test their thinking, the beginning of something, going, if we develop this, would it work? We do surveys on behalf of different companies so that we can really just make sure that we can support you in getting the patient voice involved in everything that you do. And it will work better if we do that, I think.
Great. And look, absolutely no disrespect to Northwood Park Hospital and its Harrow. There's worse places in the world to be than Harrow.
Northwood Hospital is lovely, and they are very, very good to us. But it is.
But when you finally get out of that Portakabin, we're going to have a heck of a party.
Well, yeah, hopefully. Yeah, definitely. We'll see you in London very soon, hopefully.
Yeah, Rachel, I look forward to being able to meet you in person. But thank you so much for your time today. You're giving people a lot of things to think about there, and we look forward.
Brilliant. Well, give me a shout whenever anyone wants to give me a shout to have a chat through what we can do to support your members.
We will do. Rachel, thank you very much.
Thank you.